Hi there, and welcome to Canceling COVID. I'm Tanya Rivens, and by now, COVID is not a stranger to any of us. We're constantly dealing with this pandemic that's affecting us in our community and the impacts to our families, our finances, and our daily way of life. It's really kind of surreal because we just continuously keep taking it one hit after another, but we're working through it. And here at Canceling COVID, what we do, we're standing in the gap with you every Wednesday and Friday at 1 p.m. I'm bringing you resources to keep your family safe and find some sense of normalcy during this pandemic. And boy, we continue to just keep working at it, and we will. Right now, let's turn our attention to our children and our question of the day. Is it time for students and teachers to go back to the classroom? What are your thoughts on that? Governor Cooper, he thinks so, and he's not alone, that's for sure. He's urging school districts to reopen with proper safety protocols in place. He referenced a Duke study that suggests COVID is barely transmitted in schools when everyone maintains social distance, wear a mask, and wash their hands. Now, the good news for local parents who have been petitioning for quite some time, they've been petitioning the governor, and some even filed a lawsuit for CMS. They want them to open schools. They've been at this for months. But some teachers, well, as you might imagine, they've got a major concern about returning to the classroom quickly. They're like, hold up now. But I'm going to bring in our first guest to talk about that. And it's truly an honor. I've got Tamika Walker Kelly. Hey, Tamika, I want to bring you in and let's talk about this for a minute. Tamika, she's the president of the North Carolina Association of Educators. So we went to the top here and got someone who is well qualified to represent our teachers. And I really appreciate it. I appreciate what you're doing. You took over office in March. I follow one of your friends, Justin Parmenter, on social. I'm going to have to start following you because I can see you guys really represent our educators in a great way. So good afternoon and thank you for joining us.
Well, good afternoon, and thank you for having me. And I hope everything's working.
Yeah, and congratulations to you. You look absolutely fabulous. And again, congratulations for office. And you've got your hands full. That's for sure. You knew what you were getting into. The NCAE is pushing for schools to reopen, but you guys wanted, safety first. So what does that look like to you?
So again, yes, I'm the president of NCAE, which is the largest public school organization in the state of North Carolina. And one of the things that we have been advocating for since the pandemic reached North Carolina is the safety of educators and students. And so, that looks like in schools is, of course, making sure that schools are following the Safe Schools Toolkit, which has been outlined by DHHS and the State Board of Education. We also know that means having really strict safety protocols in person, in buildings, mask compliance, transmission transparency, communication for parents and educators alike. And all of that also includes funding for resources, tangible resources like adequate PPE for all of our school workers and for students who don't have it. And also making sure that we have adequate staffing as well for more people who can do the contact tracing and testing for our health department, but also school nurses and additional resources that we will need. And now in that conversation, it also includes vaccines as well, because we know counties in the West and the East have already started vaccinating their educators, and we want more educators to be vaccinated as well to ensure their safety.
So that's a great start outlining what is needed. Boy, that's a long list. And we know that there are a lot of inequities in the different schools and the school districts. So that's a whole lot to try and tackle. We'll circle back on some of that, but how bothered are you that there was no mention of the teachers getting vaccinated when Governor Cooper gave his?
So watching the press conference yesterday, as an educator who is dedicated to students and families and to the profession, many educators were disappointed. They were hurt, they were confused, angry that in the talk about safety of students and communities, there was no mention of safety of educators. We know that schools do not run themselves, they are run by dedicated skilled professional educators who go in day and day out. to make sure that schools run successfully. And so we were, dismayed by that, but we know that we can make sure that we get adequate resources if the governor could use the full weight of his office to get educators vaccines.
So we've got the website here, and NCAE. I would guess it's North Carolina Association of Educators, and
That's correct.
don't want to take for granted, but 15 North Carolina educators have actually died from COVID, and one person is one too many, and that has to be in the back of the mind of teachers who might be in the school and have these concerns.
It is, and because educators um, risk their lives daily, actually, for children. We've gone through such a transformational period of the role of an educator, right?
Mhm.
Um, the primary goal of the educator when they teach kids is to first keep them safe and then teach them and then get them back home safely. So when we lose educators to this deadly virus, this pandemic that we are still in and going to be in for quite some time, we have to remember that these educators are loved by someone, they have families, they have their own children. And so losing one educator to COVID is, like you said, is one too many. So it's important that we recognize the humanity and the dignity of the work that we do as educators every single day. And we know that we have the resources to keep people safe, and we need to use the funding available that we have to ensure the safety of every single person that has to go into a school building.
So, Miss Kelly, back up a little bit. I can't see your shirt. Looks like you have. That's what you back up from the camera a little bit, and so we can see your full face. Yeah, very nice, and that's a much better picture too, because we can see NCAE right in front and center. So, I wanted to talk about your thoughts though on that study that Governor Cooper mentioned, a Duke study that says schools are not a source of COVID spread. What would you say?
So we know, and we worked with the doctors at the ABC Science Collaborative. We know that the study shows that schools are not a source of spread when all of the safety protocols and mitigation strategies are used. And that part gets left out because with the CDC guidelines of 6 feet and things of that nature, many schools just can't accomplish that under the current resources that they have. So it's going to be really important that the General Assembly and that the governor direct resources to our schools so that we're able to implement these safety protocols. You have schools that don't have hot water for hand washing, don't have sufficient space to even do 6 feet of social distancing. And we hear that from our principals and administrators to our school boards. And so it's really important. That study has to be contextualized. It is an important resource as we develop protocols for safety and trust in our school districts. Um, and it's going to have to be resourced as well.
Frozen up just there we go. I saw
Sorry.
the screen froze just a bit, but you're hitting on some things that a lot of educators are quite concerned about. And that study also does mention those safety protocols. But I think what you're saying is those precautions probably aren't feasible or maybe not exactly in place just yet, especially where there is overcrowding in so many schools and a real issue, especially when you're trying to do the physical distancing piece.
That is true. Under the current resources that some of our schools have, it's just really difficult to put some of these in place without additional funding from our General Assembly. And so it is our goal as NCAE, especially now that the General Assembly is in session, to make sure that school districts get COVID relief so that they can implement all of the things that are outlined in the Safe Schools Toolkit and recommendations that we get from the scientists.
So we're going to get a question of the day back We got some people hopping on and we want them to chime in as soon as we get that back up on the screen. As we're waiting for that to get up, here it is. Is it time for teachers and students to return to the classroom? For those of you just hopping on, we'd love to have your thoughts and your opinions on that. We want to share. Again, the question of the day, is it time for teachers and students to return to the classroom? Now, I've got Tamika Walker Kelly. She's the president of NCAE, and we're so proud of her. And again, thank you for joining us. We know the remote learning thing, it's just not working. It's fun, not working for everybody. It's challenging. And these kids, boy, they are having a hard time in most cases. Well, I'm not qualified to say most cases, in some cases, because I haven't seen any statistics to back that up. But what do you say to those families who are, struggling and dealing with that right now?
So I would say that I hear you and I understand. As a parent of a fourth grader who is virtual learning right at this moment, it can be challenging trying to figure out technology and school schedules and making sure he knows when to log on to what class and do his homework. And it's difficult, especially as a working parent, trying to do the work here at home and monitor my child as well. And especially if you are a frontline essential worker parent and having to leave home to do work and make sure that your kids are taken care of. And it is why educators and school districts and school systems have worked really hard to do hotspots, to do food delivery, um, to provide additional tutoring and resources. So it is a struggle, and we have to continue to give each other grace during this time because it's a pandemic. No one living has been through this experience before, and so it will take a lot of collaboration and working together to make sure that we um, try to find solutions to make the next school year better, because the pandemic isn't going away anytime soon, especially with new strands coming into North Carolina.
So I have Nina Gordon. She just hopped on, and her response to the question of the day, she feels like it's time, but only if all teachers and students get vaccinated. Her granddaughter is struggling hard as a fifth grader. Is she ready for middle school? Miss Gordon says she's not so sure. So if all the educators are to get vaccinated, Miss Kelly, would you feel a little bit better knowing that still that there is not a great balance with the resources in all of the schools and that all of them may not be able to follow the other guidelines? Would that make you feel any better?
So our educators are wanting the vaccine. It is like the hottest topic at the moment, because we are watching people in Rutherford County, Daviess County. We're watching our our colleagues on the coast and Perquimans um, get the vaccine, both of their doses, and our educators want to be back into the classroom with students. The vaccine provides another layer of protection. We know that students are not ready to get the vaccine yet because it's not approved for them yet.
Right.
But they are ready to go back to the classroom once they get the vaccine. You have educators posting just today with pictures on social media about how they are ready to take their shot. And so it is important. It is an important piece to returning to in-person instruction. But I also just wanted to note there are teachers who are already and have been since August teaching in classrooms already. And that vaccine will add another layer of protection to the things that they are already doing in the classroom.
Well, we love our educators, we love our teachers, and there are some people though that say they're criticizing our teachers, saying that they just don't want to go back to work. They're pushing for the return and saying teachers just don't want to go back in the classroom. What would you say to those critics?
I would say that a lot of the work that our educators do is unseen, and that teachers have been working and since the start of the pandemic and are continuing to work. I know teachers are staying up late, creating assignments to put into Canvas, doing text check-ins and phone calls to parents, driving around and dropping off resources, making home visits. So our educators are working and they're working harder than ever. And so what we are asking for is continued community support. We're asking for parents to join with us in a movement to get educators vaccinated so that we can return to in-person instruction. But virtual learning is learning, it just looks different. It is a model that has been around for a long time, and it is a model that we have to continue to offer as we navigate this pandemic. But we all know, the research shows, everyone knows, including educators, that face-to-face learning is best, and that is what we are striving to get to. We just want it to be done safely.
And certainly, the good educators are by no means refusing to work or being lazy, because I can attest to some of the things that you're saying. With a lifetime educator in my family, it's more teaching your students, and you're right, checking on them. They consider them their family, their babies, checking, making sure that they have resources, that they have food, especially around the holiday season, just checking on their mental state of mind. So, I take offense to it if you don't, for anyone that says that. But what are some options as we wrap things up for these students that are struggling, that don't have, the digital divide is there, or they just don't have the access or the interest, because it's a lot. So, what are there any additional resources, or how can these students be helped?
Yeah, so I will say communication is key. So reaching out to your child's educator and communicating what your needs are. Our educators have been extremely flexible during this time, meeting with parents and caregivers on the weekends or late in, at night to accommodate their schedules. It's also really important that our local governments and local officials also stress their needs to our state government and our federal government, because it is going to take an all around partnership to address the digital divide, to address the gaps in making sure that students remain fed and clothed during this time, to assist parents, working parents, in making sure that they have resources to find adequate childcare during this time, especially if they have to work. It's going to have to take a whole community effort, and we've always talked about how important the village is for our kids. When we're not in a pandemic, it's extremely more important now for our children that we are all working together as a collective to uplift and support our families during this time.
So, Ms. Kelly, you're giving some really great information. Again, our question for today: is it time for students and teachers to go back to the classroom? Well, Vanya Henderson says there's some volume problem. I hoped and thought that we'd address that. So, Ms. Henderson, and I can hear Miss Kelly just fine, and hopefully she's hearing me okay. I
Mhm.
wonder about the petition NCAE has to reopen schools safely. You guys have more than 17,000 signatures. How close are you to your goal, and any additional plans that you have, to get the word out about your cause?
Yes, so we are, the goal, of course, is to get educators vaccinated. And so we will continue to collect signatures so that we can get our educators vaccinated. This evening, we're having a town hall, which will be streamed on Facebook and for our educators to talk about how to continue to move the petition, because we know our parents, there are concerned community members and fellow educators who all want to see us return in person safely. So that is our goal, to call on Governor Cooper to help uh, get us vaccinated. If he has to call up Joe Biden or he has to call FEMA in, we are wanting him to use all of his available avenues to ensure that happens. And so we ask that people join us in that call.
And where can they go to sign that petition, to join in, to support our educators? You are so valuable to our community.
Yes, so they can go to our website, ncae.org, and they should be able to find it on there. I will also, of course, share it on your page, Tanya, so that people can sign it as well. But it's really important in this time of this global pandemic. It's not just North Carolina; it's worldwide. That we have safe conditions for our educators and our students, because they are vital to the success of our communities.
Well, I wish I could give you more than an apple. Of course, the apple for our educators is the tradition, but I know now we try and bless you with so much more. I'm just trying to say I really am grateful for you taking the time and for the work that you're doing to take care of our children, which are so important to our village, to our community, to our country. And so, thank you again for taking the time to talk with us. Please share whatever you need to share, and I will share it on my social media platforms as well. Miss Tamika Walker Kelly, our president for NCAE. Again, thank you for taking the time to talk with us. Now, the Charlotte board, school board to meet on Tuesday, and school board chair Elise Dashu, she was on this show a couple weeks ago. She's making a case for teacher vaccinations on Twitter. As a matter of fact, she's not alone. Board member Carol Sawyer, she's also suggested the governor add funding for contact tracing and frequent testing for students and teachers. That all makes sense, guys. It's just necessary. I know it's going to cost, but we're going to pay one way or the other with what's happening with our people, our little people, our children, our youth. We need to get them back in school. Lower grades are scheduled to return to in-person learning on February 15th. So they'll be headed that way soon. Today is the 3rd, so about 12 more days. But again, the question of the day is it time for teachers and students to return to school? And we're looking for your comments. So, Ms. Henderson, hopefully your volume has been corrected. We'd love to hear from you. Is it time for teachers and students to return to the classroom? Share your thoughts and comments. But what we're going to do now is turn to a growing effort to address the overwhelming spread of COVID in the Black and Hispanic community. And we've been working really hard, which is really why this whole show was launched, because it seems like our people just not completely getting the message. And of course, we are trying to save lives for everyone, but looks like the minority community kind of missing the mark. So we've got Dr. Tracia Black. She's the founder of the Genesis Project, and she's heading up an initiative to get our people tested for COVID. And she's been doing a lot of work in the community for quite some time. So, Dr. Black, I'd like to welcome her to the show if she's available to come on and share what's going on from time to time. We do have some connection problems, so trying to see if we can get her back on. Right now, we don't have her, but she's doing this all-out effort that is all around the state of North Carolina, and she's been working really hard with the Genesis Project again. And one of the things that she shared with me is our community, when we find out that we have COVID, it's too late. Our community is waiting for the symptoms. And by the time you get the symptoms, it's too late for the treatment to be effective. Now, those were her words that she shared with me, and I thought they were pretty powerful because I hadn't heard anyone say that. I haven't heard anyone share that. So here we are, the essential workers working in the community, and we're waiting for the fever. We're waiting for the symptoms before we decide, there she is, that we want to get out. Hey, Dr. Black, thank you for joining us. And one of the things I was sharing already, first of all, I've already introduced you from the Genesis Project, and so grateful for all the work. You've been working so hard in our community, and for that, I salute you because you're valuable. But one of the things I already jumped into is you shared with me, and obviously you're busy, so I appreciate you hopping in, throughout your day.
Sure.
That one of the things that was really provocative when you said that, because it stopped me in my tracks, that our people are waiting too late. By the time they get the symptoms, it's too late. So early detection, just like with most things, is key. You said that when they get the symptoms, then it's too late for the treatment. And so, could you maybe speak on that, elaborate on that a bit?
Well, I'll say this. A majority of folks who are infected with COVID-19 who come in contact may not have symptoms. And so if we're sitting at home and we're waiting on symptoms to show up to make the decision to get tested, we are missing the mark because we could be walking around COVID positive, infectious to other people, and spreading the virus. With African Americans, a lot of the medications we're on, our physiological makeup will suppress many of the symptoms, particularly a fever. By the time we have a fever, we are sick and we are going to the hospital and we are so far along in the infection that we end up having those major complications that are life-threatening.
Well, Dr.
We
Black,
cannot wait on symptoms. We must develop a protocol, some type of standard in our community where testing is key, that we're being tested regularly. There's a term that's been developed that's emerged over this last year called serial testing, minimum of once a month, recommended at least twice a month. that we get tested, symptom or not. We don't have to know that we've been infected, because the majority of folks that I call and talk to them about being COVID positive, they have no idea how they became infected, who they came in contact with. So we cannot wait on symptoms. We can't wait on someone else to tell us that they're sick and COVID positive. We need to be getting tested to protect our community and to protect ourselves and those that we love.
And we're going to
Um,
talk about that the contact tracing, because I wanted to ask you, is that kind of how you came up with the idea of spearheading this testing communities of color? Is that how you kind of created that idea?
Well, I'll say this. In March and early April of 2020, myself, along with a handful of other Black professionals in the medical field, start talking about what are we going to do to protect our community. How are we going to address this? And COVID is such a major issue, but we already know that our community has so many different layers of other issues that
Yeah.
were already challenging before COVID. And we knew that COVID could be that kind of straw that took us all over the edge.
Mm.
And it has been, and it's shown so many inequities and disparities and so many things beyond healthcare, economics, and resources. So we developed a proposal that we submitted to the state of North Carolina, um, entitled Addressing COVID-19 in the Black Community by Black Professionals. Because we truly believe that, you know, we have a unique skill set, and just who we are would have a definite impact on our ability to get out there in our communities, in rural communities and urban communities, where people would actually listen
So
and potentially respond.
is that how Groundwater Solutions, that whole title came about?
Well, Groundwater Solutions actually formed a couple of years ago in a similar situation in response to a Healthy Opportunities pilot to address safety. So we formed Groundwater Solutions a couple of years ago. And so at the time of COVID, we just emerged. And it's a collection of healthcare providers, nonprofit organizations, houses of faith that bring healthcare and resources into the community. So we submitted that proposal to the state. And in May of 2020, the state reached out about some small pieces of testing, and we've been testing ever since. And we've been going into rural communities and places that would otherwise not have access to testing.
Well,
And
we're
we're committed to doing that because we know that early detection is key. We present no barriers to testing. You do not need an appointment. You can drive right up. Um, uh, there's no, you don't have to have symptoms, because we know that that is not a prerequisite for COVID. And you may not know that you've been exposed. If you want to be tested, we will provide that for anywhere in the state.
So now this stuff is starting to make sense. It's starting to get good, because there have been barriers for people, and people even now are trying to get appointments and they can't, and they're frustrated. Oh, Ivania Henderson is asking, why can't it be first come, first serve? You know, because people are wanting to get these shots. And obviously, there's been a phase of phasing in, you know, who gets to go, and then we'll get to the next phase, because originally I believe it was 75 and older, and then we got to 65. But you guys, what you've done is you've removed a lot of those barriers. So what has the response been like for you so far
Oh,
with
it's
the
been overwhelming. Communities are immensely grateful, humble, and grateful. Now, we are administering the test right now. We have not been delivered the vaccine, but we are on the list to receive it. Okay.
Wow.
And I understand the protocols and the rules. The federal government is setting those standards of who gets what when. Um, what we can do is educate you, help you understand and articulate your risk factors so that you can be pushed up on those tier levels. Because
so
I talked to one of my staff members today, and I got everybody registered for the vaccine, but they had to do their own questionnaire. Well, she got rated at a level 4, where everybody else got rated at a level 1. So I'm going through with her to say, how did you answer those questions? Each question, and it was a couple of places where she should have answered differently. so that her risk level could be understood and she could be pushed up higher on the list. So we give education around things like that, education around COVID safety in general, and provide access to that testing and early intervention so that we stay alive, that we do not wait until it's too late and we cannot be treated.
So, Dr. Black, what would your response be to Miss Henderson, who's saying, why does it have to be first come, first serve? Does that tie into the limited amount of vaccines that are?
Well,
Looks like I may have lost Dr. Black. Ms. Henderson, I was trying to get that question answered for you. Also, trying to get Dr. Black up about the help that she needs and who can be involved. The website, if we could get that back up, people can actually reach out to her. Maybe we can get her back on before the show is starting to wrap. We've been in about 30 minutes now, and that's usually the allotted time for the show. Groundwater Solutions is groundwater-solutions.org. groundwater-solutions.org. Log on and get information. They're doing some amazing work. I wanted to find out again what type of help was needed, who can be involved. We're going to get her back on because she is doing some amazing work here in the community, and people just aren't aware of what she's doing and how we can assist her. And here's a group of African American professionals, as you heard from her, that put this together and presented it to the state, and they approved it. And who better to talk to us than us? And not taken away from any other profession, but I find that even as a journalist, when I ask the questions compared to other journalists, if I'm talking, then typically the response might be a little different. So as we start to wrap things up again, I believe we lost Dr. Black, but we're going to get it back on hopefully Friday. The idea is to get Groundwater Solutions out there and partnered and to share what they're doing so that we can all work hand in hand. Last minute announcements for me. I'll be back here on Friday. I really appreciate you tuning in, joining Canceling COVID. I'm looking for my producer to see if she's able to get Dr. Black, and looks like she's not. So what I'll say is, as always, life's challenges make you better, not bitter. I'm Tanya Rivens. Thanks for joining us and Canceling COVID. We are going to cancel this pandemic working together. Have a great day. I'll see you on Friday at 1 p.m. and thanks for joining us.